أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم يا الله يا رحمن يا رحيم يا مقلب القلوب ثبت قلبي على دينك اللهم صل على محمد وآل محمد وعجل فرجهم. Today we are going to discuss little bit about the coccidiosis and Newcastle disease of the poultry. Coccidiosis is actually a light to severe acute or chronic managemental disease of the poultry. It is characterized by high mortality, anorexia, enteritis, and mucoid to blood containing diarrhea, dropping wings, mild to severe pinpoint hemorrhages on intestine, and cecal lesions. Uh, Fluffy birds and death may also occur at the end if it is not treated. We are talking about coccidiosis. This disease is classified into two types. Number one, intestinal coccidiosis, and number two, cecal coccidiosis. Etiology So far as the etiology of coccidiosis is concerned, it is protozoan disease mainly caused by coccidia. And what are the factors which influences susceptibility? So there are two main factors which influence susceptibility of the disease. Number one, high humidity and overcrowding of the birds. Number two, moist litter causes severe outbreaks of the disease. Susceptible age. What is the susceptible age of coccidiosis? The answer is that disease can occur at any stage of the life, but mostly occur during the third week of age in poultry. And external signs includes birds seem fluffy, having blood in the droppings. When there is blood in the dropping, then this is main sign of coccidiosis. Post-mortem symptoms, pinpoint hemorrhages on small intestine, they are seen, which can be seen onto the outer surface. Intestine when cut refolds immediately. Intestine when cut, it refolds immediately. Blood in small intestine is present and also present in ceca, which is full of bloody feces. Ceca may be full with blood. So far as the prevention and control of the disease of coccidiosis is concerned, so better hygienic measures may lead to the prevention and control. Proper disinfection and sanitation of the farm is also a main thing to control this disease. Management. So far as the management is concerned, keep young stock away from the adults, and regular stirring of the litter also will lead to the prevention of the disease. Prevent dampness in the house. Prevent dampness in the house. And to keep the litter dry, add superphosphate at the rate of 15 to 20 kilogram per 1000 square feet. Treatment is very simple. ESB3 at the rate of 1 gram per liter in water may be given. And number 2, Darvisol AK plus at the rate of 1 teaspoon per gallon of the water. And number 3, Embazine at the rate of 4 ml per liter of the water may be used for the treatment of coccidiosis. Use any one of above mentioned medicines. Note it please that all these three medicines should not be used continuously. Only one of these medicines should be used for the prevention, for the control, for the treatment of coccidiosis. So regular treatment for 3 days should be given, and if one medicine is not giving response, then after 2 to 3 days second medicine may be given. Use any one of the medicine continuously. Coccidine, another medicine is coccidine at the rate of half kilogram per ton of the feed, or 25 grams per bag of the feed. And clopidol 25 is also another medicine that should be given at the rate of half kilogram per ton of the feed, or 25 grams per bag of the feed. So this was little bit about coccidiosis. Next is the Newcastle disease, very important disease regarding poultry. Newcastle disease is also called Ranikhet disease, or avian pest disease, or avian distemper. So there are three main names which are recognized regarding Newcastle disease. Number 1, Ranikhet. Number 2, avian pest. Number 3, avian distemper. And yes, Newcastle disease also, this is fourth one. Definition of the disease may be done like this, may be narrated like this: it is an infectious, highly contagious and fatal disease, chiefly affecting chickens, and it is characterized by respiratory, digestive and nervous system, and high mortality in susceptible birds. So note it please that this disease chiefly affects chickens, and it is characterized by respiratory, digestive and nervous system involvement, and high mortality is also susceptible. High mortality in susceptible birds. Etiology. So far as the etiology is concerned, this disease is caused by paramyxovirus type 1. This is called ND virus. Transmission occurs through horizontal way. Transmission of this virus occurs through horizontal way. And clinical signs, the incubation period is 2 to 15 days. There are three major symptoms. There are three major systems affected by Newcastle disease, which are as under: number 1, respiratory system as described earlier; number 2, digestive system; and number 3, nervous system. External signs includes voice production by the birds; number 2, greenish white diarrhea; and number 3, nervous signs are also depictable. Nervous signs includes convulsions, muscular tremors, staggering gaits, and walking in circles. These are the nervous signs shown by the birds affected by Newcastle disease. And internal signs includes the major symptoms of Newcastle disease is the presence of hemorrhages on the glandular portion of the proventriculus. Glandular portion of proventriculus shows the presence of hemorrhages. Reddening of the trachea, cloudy air sacs, and lung congestion is also seen. Hemorrhages in the mucosa and submucosa of intestine may also be seen in postmortem. And dark red and purplish red hemorrhages, lesions on the intestinal wall. Spleen may be enlarged in early stages of disease, and spleen may also be shrunken in late stages of the disease, but it also occurs in early stages of the disease mainly. Shrunken spleen may be shrunken in early stage of the disease mostly. Note it please, not in late stages. If I said that, sorry for that. Differential diagnosis, voice production is seen in Newcastle disease, and this voice production is also present in infectious laryngotracheitis disease, infectious bronchitis disease, in coryza disease. Voice production is also seen in CRD, chronic respiratory disease, and in fowl pox there is also voice production. So voice, if there is presence of voice production, then please differentiate it from the other diseases of the poultry like IB, ILT, coryza and CRD, and also from fowl pox, because in all these diseases there is also voice production. Hemorrhages on the proventriculus are also present in Newcastle disease, and these hemorrhages are also present in Gumboro. So please make it differentiated from this Gumboro. But present in case of Gumboro, these hemorrhages are present at the junction of proventriculus and gizzard. At the junction of proventriculus and gizzard, hemorrhages are present in case of Gumboro, but in case of Newcastle disease, these are present in only on proventriculus. Respiratory symptoms, respiratory symptoms along with greenish whitish diarrhea and hemorrhages on the glandular portion of proventriculus confirm this disease. So note it please, if there is presence of respiratory symptoms along with greenish whitish diarrhea and hemorrhages on glandular portion of proventriculus, then it is confirmed case of Newcastle disease. So now next is the prevention and control of Newcastle disease. For that, we should avoid entry of new birds in the flock. This is number 1. Prevention and control measure. Avoid entry of new birds in the flock. Number 2, feed and water should not be contaminated. And number 3, hatchery away from broiler dressing and other poultry operations. And number 4, adopt strict biosecurity measures. And number 5, vaccinate the birds according to the schedule. According to the schedule, vaccinate the birds. And if the type of the bird is broiler, then vaccination should be done for Newcastle disease at the age of 7 to 10 days. Eye drops should be given. And next vaccination in broilers should be done at the age of 25 to 28 days. Half cc intramuscular injection should be given. So in broilers, these two doses should be given at the age, first dose at the age of 7 to 10 days through eye drops, and second dose at the age of 25 to 28 days through intramuscular injection, half cc, at the rate of half cc. And if layers are present, if there are layers, then vaccination, first vaccination should be done at the age of 7 to 10 days through eye drops. Second dose should be given again at the age of 25 to 28 days at the rate of half cc intramuscular, and third dose should be given at the age of 4 months at the rate of 1 ml intramuscular, 1 ml per bird intramuscular. Then repeat this vaccination after every 3 months. 3 months. Lasota 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 ND vaccine should be given after every 3 months in drinking water. Due to any stress or disease, antibiotic level may reduce. Then do not wait for 3 months interval. So if there is disease, any other disease, or if there is a reduction in the level of antibiotics, then don't wait for 3 months. Please vaccinate your birds, your poultry birds, before 3 months. And birds, in case of an outbreak, if there is any outbreak of the disease, adopt all sanitary measures and vaccinate all the birds, apparently healthy birds and also other birds, as much as early as possible. No proper treatment is available if there is outbreak of the disease, because this is a viral disease and it is very difficult to control this virus. So please concentrate on vaccination schedule, concentrate on the controlling measures, sanitary environment, hygienic environment, and better managemental practices may lead to the reduction of the load of the disease. If there is outbreak of the disease, it is very difficult to control this disease. So this was about little bit about Newcastle disease. Thank you very much. Here is a very hot summer season. So you are seeing that there is a high level of perspiration over here. Thank you very much. Jazakallahu khaira. Allahumma salli ala Muhammadin wa ali Muhammad.